Hi parents, I am Dr. Sailesh Gupta, a pediatrician in Mumbai. In my daily practice, at least 10 to 12% of parents approach me for a solution to their child's constipation. A constipated child is one who does not pass stools for several days together, or passes very hard stools, or has difficulty in passing stools. That is, stooling is painful for the child. And this constipation gets complicated by the fact that when a child passes hard stools, it injures the anus and it leads to anal fissures, which are very painful. So this child refuses to pass stools, and the stool that remains in the large intestine hardens further, and it kind of potentiates the problem. It creates a vicious circle. So the child refuses to pass stool, it becomes harder, it becomes more painful, and this vicious circle is what we need to break with our intervention. Now, there are several causes for a child getting constipated. If an infant and then a toddler is fed more on milk diet, especially if he is bottle fed and he does not take enough fibrous food which is needed to form stool, so he's not eating grains, he's not eating vegetables, he's not eating fruits, so these children tend to remain constipated. And then there are some lifestyle changes that can happen in a young child's life that can lead to constipation. So joining a play school where he's not comfortable sitting on the toilet in the school, he does not get to drink as much water as he drank at home, the weather is hot, he's sweating a lot, so there's not enough water in the intestines. So all of these can lead to constipation. Then stress in a young child's life for whatever reasons. Even going to school is stressful. There are those playful children who are so engrossed in play that they actually ignore signals to defecate when they want to pass stool. They ignore it, they continue to play, and the stool becomes hard and they get constipated. Then there are those shy children who do not wish to go to the toilet. Then there are those stubborn children who refuse to go to the toilet. So various conditions can lead to constipation. But it's treatable. We can treat it with love and care, with the right kind of instruction for parents and for the child, and that is what we are going to discuss today. So the first line remedy for constipation becomes: do not bottle feed your child. Do not continue to give only milk beyond 6 months of age. Introduce foods that the family would eat. Okay, so that the child learns to eat, and by the time he's 9 or 10 months, he's taking in enough fiber to form soft stools. Bread and biscuit, which are not whole grain products, these tend to cause constipation. Give more fruit, more vegetables. Okay, so best is to give home food. Now, Indian food is a good combination of grains and vegetables and fruits if we follow our culture. So if we do that, these children are not likely to get constipated. But those that are resistant to this first line treatment may sometimes need to take in stool softeners or laxatives for a short period of time so that they can pass soft stools and the fear of stooling disappears from their minds and the anal fissures heal so that stooling is not painful for them. So this basically is the treatment for constipation. Good way of avoiding constipation is to toilet train your child at the right age. So let's say beyond 18 months of age, when your child is mature enough to understand your instructions, is familiar with the toilet at home, we can start what is called a toilet training process. Now, a lot of parents get very worked up about toilet training. When should we start? What is the right age? Will the child respond? And those parents get so anxious that they transmit their anxiety to the child, who then refuses to cooperate with the whole process of toilet training. So I want to tell you today, it's easy. So take it easy. Do it with love and care. Do not push your child into a corner to make him pass stool. You are the coach. So be a loving coach. You're the right person to help your child through this process of toilet training. So we'll tell you how to do it. Clever and cooperative toddlers, we can actually start the process of toilet training by about 1.5 years or 18 months of age. But definitely in most children, we can start toilet training between 2 and 3 months of age when they are able to understand our language, our instructions, and cooperate with us. So what we should do is familiarize them with the toilet pot. And we can do this by introducing words like poo and pee and susu and potty in our daily dialogue, so that they understand this means emptying out the bladder or the bowel. We need to kind of instruct them or tell them that whenever there is the urge to pass stool or urine, they could come to the parent, come to us, and then we should gently lead them into the toilet where the passing out of the stool and the cleaning up is done, so they understand that this is the place where we need to empty ourselves. So they may not cooperate completely in the first few days, but we need to give them time, be patient with them. Do not punish them because they haven't followed your instructions or achieved your objectives. Actually, you can go and buy a potty seat. You get those fiber ones or plastic ones which you can buy for your son or your daughter, and so they actually play with those potty seats initially. They sit on them, play horse while they're with their clothes on. They get familiar with it, so they don't get scared of sitting on the potty seat when they have to empty out. We can look at a child's expressions and understand that he or she wants to empty out. So at that point, take them into the washroom and place them on the toilet seat and encourage them to empty out. Those children that are constipated need to be helped with sitting on the toilet seat every day, even if they don't want to pass stool. So let them sit there for 10 or 15 minutes and we sit with the child, maybe play a song or read a book. So the body tends to recognize the fact that the child needs to empty out every day, and kind of the whole gastrointestinal system tends to cooperate with the child's mind and with the parent, and they tend to pass stools every day, and constipation is taken care of. So all of these measures, giving a lot of water to drink, avoiding only milk-based diets in toddlers, giving them more fiber in the form of grains, fruits, vegetables, avoiding stress in the family, avoiding anxiety in the parents. So all of these measures will help in toilet training as well as managing constipation. But in some cases that are resistant to even these measures, we may need to use stool softeners or laxatives for a short period of time. So polyethylene glycol, or PEG popularly called, is a good laxative, a good stool softener. It kind of pulls in water into the stool and makes it soft. It's available as a liquid as well as a powder. So the liquid can be given to children easily from 1 year of age. The powder needs to be mixed with either water or fruit juices and given to the child. It's usually given once a day in the prescribed amount, and you need to give it for a period of 15 days or maybe 3 weeks until the child has improved his diet, has improved his water intake, and then will naturally pass soft stools and will not use a stool softener. It's not a habit-forming medication. It's given for treatment, so it's perfectly safe and it's very effective for use. So parents, in addition to all that I have told you today, you are very welcome to look at your own resources for more information, more tips. The internet is flush with information for parents. You have medical books for parents. You can read up and gather your own tips for toilet training and to manage constipation. But while you're doing that intellectual exercise, please do not forget to the emotional exercise of offering your child support, hugs, smiles, cuddles. Do a lot of that and ensure that your child cooperates in the process of toilet training and for the management of his constipation. Remember that your success lies in your child's success, and my best wishes are with all of you. Thank you very much.